Welcome back, my sisters and even possibly brothers. We're on our second lecture in a series on being woman. Okay? We are discussing, we already did the anatomy and the physiology and the study of the hormones in a woman. So now we're coming to what is the result of all this, which would be covered in our lecture this afternoon, today. Today, our lecture is the physiology of menarche and the physiology of menstruation. So those two are different. So what is menarche? Okay, menarche is the occurrence of the first menstrual period in a female adolescent. It's regularly in an adolescent, okay? So it is the first blood flow. That is what you call menarche. It occurs as the HPO, hypothalamo pituitary ovarian axis interplay starts maturing. So when your hypothalamus, your pituitary, and your ovaries, they are now like, okay, I agree, they all agree, they're starting to work together. When they start interplaying maturely, then you start having the first blood flow. That's you call the menarche. We talked about the HPO axis, right? The hypothalamo pituitary ovarian axis. It is now it's a tightly and highly regulated hormonal mechanism of the control of the female reproductive tract, positive feedback loop. Then if there's this problem in the loop of release of hormone and negative feedback, release of hormone, negative feedback, if there's a problem there, then you can manifest in abnormal menarche, whether it will come early or it will come late. So here is sort of like what we have in the picture that I have here. You have here at the base of the brain, the hypothalamus, okay? Underneath the hypothalamus, you have the pituitary. From the hypothalamus, you see positive because it's being secreted. It is being secreted and the amount is increasing in the bloodstream, the level is increasing, and the pituitary gland notices it and obeys the command of gonadotropin releasing hormone. So the hypothalamus is telling the pituitary gland, release your hormones to the gonads. Give your instructions to the gonads. So what are the instructions that the pituitary gland are supposed to give? It is the follicle stimulating hormone first, which stimulates the eggs to grow or the follicles to grow. And then as they mature, we have ovulation, okay? So as the eggs are growing or the ova or the follicles are growing, estrogen is being released, okay? So positive, estrogen is being released. And because it's increasing in the bloodstream, it is noted in the pituitary gland and in the hypothalamus that there's a lot already of released estrogen. So it says, oops, stop giving instruction because estrogen is here already. So what gonadotropin releasing hormone is going to do, what hypothalamus is going to do and pituitary gland is going to do, they put brakes and they don't release because estrogen is already present, okay? So then when ovulation occurs, what happens is the part that covers the egg that's left behind, we call that the corpus luteum, it releases progesterone, okay? So when progesterone is released, it goes into the bloodstream, goes to the pituitary gland, and also goes to the hypothalamus and says, we're here, progesterone, we're here. And so when the hypothalamus and the pituitary gland says, oh, pituitary gland, progesterone is being released, so they quit releasing, they start releasing gonadotropin releasing hormone again. So it's like this, it's like that, and then it goes this way. So it is when there's a negative, when there's an increase in amount, the instruction is stop. When there's a decrease in amount, the instruction is go, okay? So that's a negative feedback loop. That's what they say. Tightly regulated hormonal mechanism of the feedback loop. And it can only occur in the presence, okay? Only occur in the presence of a normal hypothalamic and pituitary function. If your hypothalamus is not working, because there are cases when the hypothalamus is not working. There are cases when the pituitary gland is not working. If they're not working, then you do not have your HPO axis working. You don't have menarche. And you have to have your ovaries there. You have to have your uterus there. Okay? If you don't have your reproductive anatomy there, no matter how much GnRH, FSH, and LH is released, but the uterus is not there, the ovaries are not there, nothing's gonna happen, okay? Because there's no reproductive anatomy that's present there. And if your nutrition is problematic, either lacking or exaggerated, your menarche will either be pushed forward or pushed backward. So food intake is very important. And also, if you have diseases, okay, chronic disease like probably TB or a severe inflammation that can disturb your metabolic processes, then it can affect your HPO axis and menarche can be adversely affected. Okay? So far, that's what we know, and some more on it. So menarche, on average, it's the onset is 12.4 with a range of 9 to 15. That's where more or less normal, okay? 12.4 is the average, but you have a range from 9 to 15. And it depends, okay, whether it's going to go forward or go backward. Now, menstruation may be irregular at this time, so you might have bleeding already, you first bleed, but then the next month is irregular. It's not for 2 to 3 years, it might come every month. It may come every 3 months or every 2, and it's irregular. Sometimes it will come the next year, depending on your pituitary axis, depending on the food you eat, depending on whether you're sick or not, depending if your ovaries are functional or uterus is functional. It is usually associated with the growth spurt of puberty. So, like, okay, what's puberty? It's when the breasts start to grow, the hips start to become curvy now, and she starts to become pretty, okay? She starts showing that she's a woman, okay? She's starting to grow into maturity. This menarche will not happen if there is no spurt of puberty, okay? Puberty has to spurt, and then menarche comes along with it. Menarche also most commonly occurs with a sexual maturity rating or TNR stage 4. I don't want to go into deeply into this, but there is a staging, they call it Tanner staging, how wide the breast bud is, whether there's pubic hair or something like that, sexual maturity rating. So menarche commonly occurs with that. So she's supposed to have breast buds already. She's supposed to develop some changes in her pubis and her pelvic bone, and that comes together with menarche. Menarche does not come without this. It has to, because that's a hormonal stage that increases estrogen increasing and making her go into this. Now, the menarche is a signal, okay? Menarche is a signal that the female reproductive tract is well and healthy. So, parents, they're like, oh, I'm waiting for when my little girl is going to become a lady. When I first had my menses, they started singing in the house, and I was so irked. I was 14 then, and they started singing, something happened to Cherie Lou. She's not the same anymore. I was so mad because but I didn't have my menses regularly. It came every 3 months, and then finally when I turned 16, it started to become regular. Something happens. And also, I remember that, when we were going to school around the 12, 13, 14 years old, and we're going, all boys and girls going to school together, and you'll notice that around 12, 13, 14, that the girls start growing quicker and faster, and they become taller than the boys. That's part of the growth spurt, right? And that's part of the girls develop the breast buds, the pubic hair become more prominent, and then the shapely thing already, the menses are there, and then there's this growth spurt. This all come together around the time of menarche, okay? So it is important for us to know these things, because menarche will not happen if this these signs and symptoms, or the Tanner stage or the sexual maturity rating does not occur. So if we have a child or a daughter that's already 15 years old and she has not developed breast buds, she has not developed the rest of the other secondary sexual characteristics, then there might be a problem. And you also have to take into consideration that the onset can be affected by ethnicity or race. In other words, it depends on our race. The white race, they develop a little later. So if the average is 12.4, the white people develop their menarche somewhere away from 12.4, and the colored races develop a little below 12.4. So race or genes has something to do with it as well. So menarche also can be affected by the thyroid gland, okay, which is the one that dictates our metabolism, the adrenals, and the pancreatic hormone. So the thyroid hormones are necessary for normal menses. So if they don't have thyroid hormone, you would have irregular menses. And their deficiency or excess of the thyroid hormone can inhibit or lead to abnormalities in existing menstrual patterns. So the thyroid also dictates when menarche will come. Also the adrenal androgens and insulin, depending on how the adrenal gland secretes its hormones, sex hormones, and the other hormones as well. It will all, and insulin together, because metabolism is affected by this as well. Then it would also dictate whether you're gonna have early or late menarche. Now this one is very, very, what they call this, to me, very important. Low adiposity. In other words, the lean person, okay? Low adiposity can inhibit menarche. In other words, if you are on the lean side, you're gonna have menarche later, okay? And the statistics say that it is estimated that a minimum body fat of 17% is necessary to push you to menarche, but you need 22% fat necessary for maintaining normal menses, okay? So you need 17% of your body to be fat. So if you're very, very skinny, hardly any fat, most likely your menarche will be late, okay? If you're on the plump side with more fat, your menarche will come earlier, okay? So that's very important, because then if you have menses early, then you I don't know whether there's really truth to this, but the old woman's tale goes this, that if you although I believe that when you menstruate more and more and more, you're prone to develop problems of your reproductive tract. So the earlier you have your menses, the more problems you probably will have, okay? And if you're early on, your HPO axis might not be functional yet or mature, so then you have problems associated with it as well, right? So you don't want a person very thin or on the plump side. Now, the hormone leptin. Leptin is a hormone that comes from the fat cells, and it's the one that tells us, stop eating, okay? But if the hormone leptin, it appears to have a role in the maintenance of normal menstrual cycles as well. Because if the leptin is not telling you to stop eating, you eat and eat and eat, then you're gonna have your menarche early. Plus, stress and obesity appear to be predictors of early menarche. So when our children are put through, our little girls are put through stress, and being obese, they will have menses early. They will have problems associated with early menses, and you really don't like that to happen. Some more on menarche. Typically adolescent females, right, who experience menarche are not ovulatory with every cycle in the first year. As I said, 2 to 3 years before it becomes normal. So typically adolescent females who go into menarche will take about a year before their menses become regular. It is estimated that most will have ovulatory cycles within 5 years of menarche. If you don't have it within 5 years regular, there's a problem. That's delayed menarche already, even if you had one blood flow. So you want to have a regular cycle, more or less within the 5 years of your first blood flow. Because if not, you have a problem. Now, we have what you call the imperforate hymen. Imperforate meaning there's no hole. So, the hymen is sort of like a membrane that's in the exit of the vagina. And if it is imperforate, that means when there's egress of blood, when there's menstruation, the menstruation cannot come out, okay? It will be accumulating within the vaginal wall, and it becomes like a pseudo mass of blood that's accumulating in the birth canal. Now, I've seen an imperforate hymen. We check it in babies, actually, when they're born, baby girls, and we check for the hymen whether there's a hole or not. Because the imperforate hymen really is not really very, very rare, but 1 in 1,000 to 1 in 10,000 in prevalence. I've seen it, so it's not really that rare. I've seen it like twice in my practice, okay? It can be noted at birth. The pediatrician can check it, okay? It's very important for her to be checking because it has problems. Okay, now for menarche, we have the absence. No, the absence of a normal uterus or vagina. Of course, there's no uterus and there's no vagina there due to the Mullerian agenesis. Mullerian is like a tract that the uterus and the vagina develop from embryonically. If it doesn't grow, you call that Mullerian agenesis, okay? It doesn't grow. And they call this the Mayer-Rokitansky-Kuster-Hauser syndrome. It has an incidence of approximately 1 in 4,500 females, and often is not diagnosed until a patient presents in the absence of menarche. So she's like, I saw this one time, only once. It's not really very, very common, but I saw this once. And she was wondering why she couldn't get pregnant, okay? We did a follow-up, we did everything, and we found out that she didn't have a uterus. She had a vaginal canal, but didn't have a uterus. She had 2 ovaries, but no uterus. So this is partial Mayer-Rokitansky-Kuster-Hauser syndrome. So how can she have menses when she has no uterus? So this is it, right? So you can have absence. So that's why you have to check, because she might have like this. Then when I was in high school, I watched a movie, okay? And it was talking about, if I remember right, the title was My Mother, My Grandmother, sort of like that. Because there's this daughter who had this syndrome, and she couldn't get pregnant, but they harvested her eggs, and then they fertilized it in vitro, and then they planted it in her mother. And the mother took hormones, and the grandmother became, the baby grew, and the grandmother delivered the baby of her daughter. Because her daughter had Mayer-Rokitansky-Kuster-Hauser, the modern medicine and the miracles or the things that can happen under it is awesome, otherwise she would not have a child. But then this is a true story. Okay. Another one is other complex hormone abnormalities such as androgen insensitivity syndrome can present with external female development and primary amenorrhea. So she's like, because androgen is the male hormone, right? Androgen is the male hormone. And if the male hormone is not present, then the male characteristics will not happen, right? So what is going to happen? The female characteristics will happen. So this child will grow up like a female, with female characteristics, but really is a male. But she has, or whatever, has androgen insensitivity syndrome. Her body or his body his body, because it's a he, his body does not obey the command of androgen. So there's no receptors for androgen. So therefore, this guy will develop female characteristics instead of male. So, but however, no menarche will happen because there's no uterus. Then you also have the Turner syndrome. Turner syndrome is a genetic problem where instead of having XX chromosomes for sex chromosomes, you have only one X and no other X, okay? The woman is XX, man is XY, okay? But this one, in Turner syndrome, you have one X and no other X. So you have an XO syndrome. They call that Turner, and she doesn't have ovaries that are working. Their ovaries are agenetic, rather, they don't grow. There's agenesis of the ovaries, and there are absent menses. So that's not really going to happen. Okay, menses are not going to happen in this one. So we're done with Menarche. We really want to catch whether there's a problem with Menarche, because if there's a problem with Menarche, there are things that we might be able to solve. However, if they are structural problems, they're real problems, then you have to go to the doctor. No amount of hormones, that no amount of natural remedy will help sometimes. Okay. Now we talk about the menarche is when you're starting to become sexually mature, right? So we have alteration of sexual maturation. So we are going to talk about this. So there's one, precocious puberty. So early, she gets into puberty very early. Is defined as the onset of clinical signs of puberty before the age of 8. I know about a patient who developed precocious puberty at 6 years old. Very, very early puberty, meaning she was developing already her secondary sexual characteristics, breast buds, starting to grow tall, starting to have curves, starting to have pubic hair and everything, but she was only 6 years old. Now, these are the causes. Maybe there are genetic factors, and epigenetics can play a part. There might be increase in obesity. My classmate in high school, his sister had menses at 6 years old because she was on the plump side. Because when you're obese, the ghrelin, leptin, the eat now and stop eating secretion hormones are disrupted. So there's no more break in eating. The obese person continues to eat, and so the sexual maturation is pulled early. Okay, so precocious puberty, and also increase in protein consumption. So nowadays it's really cheaper to buy chicken, or it's really easier to buy maybe beef or whatever. It's then going and cooking beans is too much work. You have to soak it overnight. Then you have to pressure cook it. Let's just cook chicken. It's easier. So then, and it's faster and it tastes good. So they go for that. With increased protein consumption, there are studies that prove that when you have a large amount of protein intake, your menarche starts early and you can have precocious puberty. So watch for protein intake. Then you also have what you call the use of endocrine disruptors. Now, endocrine disruptors, I want to talk about this because it's very important. We are not really quite cognizant of this. We should be cognizant of this because I can give you some examples of endocrine disruptors. We have BPA, okay? You know this, it's very common. They hear this. BPA-free water bottle, BPA-free, cans, etc. Because in the lining of the can and in bottles, you have plastics inside the canned goods, and they leach BPA into, and it's in the food you eat. And these ones are endocrine disruptors. So they disrupt your endocrine system, and you can result in precocious puberty. You also have dioxin, which they put in processed meats. You eat the meat that has been processed using dioxin, and so you have precocious puberty. You have also phthalates, which also can come from plastic bottles. They also can cause precocious puberty. Then you have PFCs. These are the ones that are lining your nonstick pans. They leach into the food you're cooking. You fry. Oh, nice. You can fry so easily. Your food's not sticking to your pan, but you're getting something that can cause your daughter to have menses early. Okay? Precocious puberty. So it's very important to diagnose this one, sexual maturation alterations, because it can manifest caused by life-threatening central nervous system, ovarian, and adrenal tumors. So precocious puberty may not be, alterations in epigenetics. It may not be obesity. It may not be protein consumption. It may not be endocrine disruption. It might be a tumor in your CNS, central nervous system, your ovaries, or your adrenal tumor or your adrenals. So we have to be watchful for this. It's very important for us to watch. Now, so I have here in my slide a very important thing that I can show you what is one of the reasons why we have an increase in precocious puberty in our society. So here is human milk. You have the calories of 172, but protein 2.4 only. But cow's milk has 7.9, okay? So protein intake in cow's milk is very high compared to the milk. So the baby that's drinking cow's milk, okay, the formula cow's milk will grow faster and mature earlier than the one that drinks the human milk or stops drinking milk when there's already teeth, okay? I went into some study about why did the Lord say you stop breastfeeding? Oh, you already have teeth. When you have teeth, you don't need to suck the breast. You can now chew. You see, we're still giving cow's milk, like we're still breastfeeding. I don't know. That's the way our society goes. And this one is showing that increase in protein intake, not only chicken, but including milk. And some people use milk as their water. Yeah, and juice. And so that there's this protein intake increase. So continued is the opposite, the delayed puberty. What we talked about was a puberty that was advanced, precocious. Now we come to the delayed. So about 2% of patients in North America experience delayed, only 2%, okay, better. Delay in secondary sex characteristics. Puberty normally occurs between ages 8 to 13. Yeah, we know that. But the first sign of true puberty is when the breast development, or thelarche, you call that, occurs at 13 plus or minus 2 to 2.5 years. If by the age of 15 or 16 and menarche has not yet started, the diagnosis of delayed puberty is made. Okay, so the problem with delayed puberty is you can have significant psychosocial implications. Oh, my friends, they're all having menses, already wearing bra, and they're very sexy, and I'm the one that's not wearing bra. I'm not sexy. I'm still like a girl. I'm not grown. I'm the shortest. So you have significant psychosocial implications and risk of you're supposed to be growing already at this time, but you didn't mature sexually. So right when you go into early menarche and menarche and growing to have your sexual characteristics, but you're not growing because your sexual maturation is not coming. So therefore, you can have the risk of inadequate skeletal development and mineralization. So then you can have easy, fractures of the bone. Well, the causes for delayed puberty are physiologic, like normal hormones and intact HPO axis, but maturation is just slow. So sometimes, there are just people that it's in their bloodline. They have menses when they're 16 years old. Okay? Physiologic, it's just in their bloodline. Familial, 30% ultimately progress through normal puberty, but they are on the low body fat. Okay? So you're aware that if you're on the low body fat, your menses come late. If you're on the heavy set side, your menses will come earlier. Okay? And some functional causes secondary to an underlying condition. Okay? Like from anorexia. So people who are anorexia, they're not eating. Okay? And when they do not eat, they're very thin. Okay? So when that happens, they won't have their menses normally. And you can have pathologic causes, which would be genetic problems, tumors, radiation, and chemotherapy. So we really have to watch for these things, right? Sometimes we take them for granted, and then when we have them diagnosed, it's too late. So we want to be watching for these things. We talked about menarche. It's early coming and it's delay. So now we're going to talk about menstruation. Menstruation is the monthly shedding of the functional layer of the uterine endometrium lining. Okay, so this is the uterus. Okay, and you have the endometrial lining here. Okay, this is the endometrial lining. Every 28 days, if you're having a regular menstrual cycle of 28 days, it sloughs off if you do not have a pregnancy. So it says here, is the monthly shedding of the functional layer of the uterine endometrial lining that occurs when ovulation is not followed by a fertilization. So you ovulated, but there's no sperm that fertilized the egg. So the egg will come down and it did not implant because it's not a pregnancy. So then it comes down. There's not enough hormones to make the lining plush here. And then it will come out. It sloughs out. On average, it comes every 28 days, plus or minus 7. So that means 21 days to 35 days is sort of like average with a duration of 3 to 5 days in between. So you can have menses every 21 days for 3 days or every 35 days for 3 or 7 days, which they would say would still be within normal. I prefer to be on the 28-day cycle because it's easier for you to get pregnant. It's easier for you to control. And more or less, you can really say that you have a normal hypothalamo-pituitary-ovarian axis. Normal menstruation is an indicator of fertility and reproductive ability. Its absence should be a signal the signal to the provider to evaluate for pathology. So if the menstruation is too frequent, more frequent than 21, too delayed, more delayed than 35, this has to be checked because there are problems associated with it. So here is, this is relatively very complex, but we'll try to go through it. This is important for us to understand this. So you have here the hypothalamus again. Going back to this, we'll repeat this all the time. Hypothalamus, pituitary, FSH, LH, follicle, estrogen, luteinizing hormone, progesterone. Negative feedback, positive. Okay? So we have here our pituitary gland secreting follicle-stimulating hormone. So the follicle is growing, and then luteinizing hormone is released and the egg is released in ovulation. And what is left is your corpus luteum. And this corpus luteum secretes progesterone. This one here, the follicle that's growing, secretes estrogen. So you have more estrogen in the first half of your menses and more of progesterone in the second half of your menses. I said earlier that estrogen is catabolic, meaning it builds up. So you see the lining of your uterus? It will grow, so that making it ready, because estrogen makes the lining ready for implantation. And then the progesterone comes and matures it. It's sort of cultivating the uterus lining, endometrium lining, so that if there was a fertilized egg, it would be fertilized in this plush garden of the endometrium. When all of these will only come about if your HPO axis and uterus are working properly. Okay? So I hope you got that. In the first half of your menstrual cycle, this is the start of the mens, and then another start of the mens. This is the menstrual cycle, and this one is the ovarian cycle. So in the first half of the menstrual cycle, you have an increase in follicle-stimulating hormone, which makes the ovaries grow and mature. And as they're maturing, they're releasing estrogen, making the uterus become fertile. Okay, grow. Then luteinizing hormone is released, the egg is released, and when the egg is released, corpus luteum starts to come out, progesterone is secreted, and there is ripening of the uterine lining. Without these orchestra of endocrine organs and endocrine function, or hormones you call that, you will not have proper menstruation. If there's no menstruation, if there's no ovulation, if there's no proper HPO axis, no pregnancy is going to happen. Okay? So let's go forward. It is like that. It's that important. Now, you remember the story of Rachel, right? When Laban had to, Rachel and Leah and was it Jacob, they ran away from Laban, okay? They were, because Laban's workers and Jacob's workers were already starting to squabble on their cattle and their sheep, and they're having problems already. So they had to leave, okay? They had to leave Laban so that Laban's shepherds and etc. cattle and um, livestock will have enough place to graze. And so and Jacob was tired of Laban always increasing and increasing, making him stay longer and longer, and changing his wages. So he went away. And before they left, what's her name? Rachel stole the idols of Laban and put them underneath the what do you call this, the blankets or the mantles here in the camel. And when Laban came and said, "Oh, what did you do? Why did you get somebody stole my idols, etc." And they looked through all the things of the caravan of Jacob, and they couldn't find it. And Rachel was sitting down on it, but she said, "Oh, it's a time of the woman's life when I'm bleeding," and it was not so. You can't touch a woman who's bleeding in Bible times, okay? So she she was able to get away with it. She was able to steal it away. This is in Bible times, because during menses you are unclean. Okay, I just want to share with you something very important from the Bible. Biblical bloody discharge care. Now, according to Leviticus 12, the male baby, when it is born, the mother is unclean for 7 days plus 33 days to becoming clean. But if it is a female baby, she's unclean. The mother is unclean for 14 days plus 36 days to becoming clean. So it takes a longer time for a mother who delivers a baby girl. It takes longer for her to become clean compared to if she had delivered a baby boy. Okay? So it's because estrogen makes more endometrium, makes plumper endometrium, and even the estrogen from the baby can even affect the mother, the same way as the estrogen of the mother can affect the baby. Okay? And in Leviticus 15, we also have after discharge or bleed. So when you have menses or if you're bleeding, you are unclean for 7 days. And if you're bleeding, you're unclean. Remember the story of the woman with the issue of blood for 12 years? She was unclean. Nobody would come near her. She would say, "Unclean, unclean," But you're unclean when you're bleeding. Because that's helping you, because when you are having menses, the cervix opens. And because it allows the blood, the lining to slough off. And if you have sexual intimacy when you're having menses, bacteria from the vagina or from whatever things that are there in the vagina can go into the uterus and cause an infection. And it really can happen. We call that pelvic inflammatory disease, and it is common. The problem with pelvic inflammatory disease is it can cause infertility because it can cause blockage in the fallopian tubes, and so the egg and the sperm cannot meet and be fertilized. So it's very important, that's why the Lord said you're unclean at this time. No sexual intimacy according to Leviticus 18, because you can have problems. If you can practice this, they were practicing it in the olden times, we can also practice it in this time. God will He protected his people then, he will also protect his people now. So I'm sharing this with you because it's important for us to know. I don't like it's the time of the year, it's the time of the month already. I have migraine, I have painful uterus, painful back, suffering from menses. Okay, and on top of that, my menses were profuse, It was tiring. But you see, God knows what we can bear. As women, we need to go through these things. It just happens we are women. But it does not necessarily mean that it is the end of the world. We will rejoice that we're having menses, because when we have regular menses, that means Our bodies are working. Our HPO axis is working. We're normal. There's a possibility for us to get pregnant. We are glad when that happens. If not, then you got to have pay this, pay that, watch this, watch that, do this, do that, you know? So be glad because we, despite the trials that women go through, we can rejoice because we can be the women we can be by God's help. So shall we bow our heads in prayer? Gracious, loving Lord, you are the designer of our hypothalamo pituitary ovarian and organ axis. Such complexity. All organs, all hormones working in symphony. I cannot begin to understand how people don't trust you. When you orchestrated all this, you designed all this could not have happened by evolution. Women would have been dead. No more reproduction. It took millions of years to develop the uterus. No more. Nobody can ever get pregnant over no more uterus. But you made Eve. You made her to be the helpmeet that she could be. You gave her the strength. You gave her the genes. You gave her the hormones to be the woman she could be. Unfortunately, when she sinned, she suffers, and the whole world is suffering with her. All women are suffering. But Father, thank you so much because you're there for us. You will never leave us. You will never forsake us. Thank you, Father, for being everything for us, women and men, as we serve you. For Jesus' sake, we ask. Amen.